Hi, this is Eric Ruderman from Northwestern University in Chicago, and I'm coming to you here from the ACR meeting in Atlanta in the Room Now booth. I've been paying attention to psoriatic arthritis at this meeting, and there have been a number of really interesting studies that have really helped us understand how we manage our psoriatic arthritis patients. One of them was a really fascinating study that was a withdrawal study with Ixekizimab, the IL-17 inhibitor. Pretty simple premise. They put about 350 patients or so on Ixekizimab at the usual doses, and at 36 weeks, if they were in minimal disease activity, and about 40% were, they were randomized to continue the Ixekizimab or a placebo. And it was blinded, so they didn't know what they were taking. Fascinating that over time, as they followed them out, virtually all of the patients who were randomized to placebo eventually flared, or at least came out of minimal disease activity, and were restarted on Ixekizimab. Also interesting was that a percentage of the Ixekizimab patients lost response over the same time period. The second piece of the study looked at what happened to those patients when they restarted drug. Not surprisingly, those patients who went back on Ixekizimab, who'd failed the placebo, did well, and virtually all of them went back into minimal disease activity. A bit the surprising part, I suppose, was how many did well. The other interesting thing was that the patients who were originally on Ixekizimab stayed on Ixekizimab, lost response, and then were put back on Ixekizimab that they never stopped in the first place. Many of them did well the second time. The key takeaway from this, I think, is it tells us that when you put a patient on drugs, certainly an IL-17 inhibitor for psoriatic arthritis, taking them off the drug is not going to be an effective strategy. Maybe reducing the dose over time, but we couldn't see that in this trial. Maybe that's the next study.